much for joining me once again. Today, we are going to be talking about some alarming and early signs and symptoms of diabetes. First of all, we want to establish what diabetes is. So, diabetes would occur when your body is not able to convert glucose or sugar to energy. Glucose is basically sugar, and we get glucose from carbohydrates containing foods that we eat. You can get glucose from rice, pasta, your cereal, and some fruits contain glucose. When glucose enters your body, there is a hormone called insulin that is secreted by an organ called the pancreas. The pancreas releases insulin, and insulin converts glucose to energy. So there are some times when insulin is not secreted by the pancreas. Sometimes the insulin is secreted, but it's not enough to convert glucose to energy. Sometimes even when it is secreted, the body is not able to use it to convert glucose to energy. When this happens, the glucose levels in the body becomes a lot, and this is when diabetes occurs. So there are two types of diabetes. We have the type 1 diabetes and the type 2 diabetes. Type 2 diabetes is very common in older people, and lately even younger people are developing type 2 diabetes. And that is when you have a residual amount of insulin in the body. That is, your body, the pancreas is able to secrete some insulin, but it's not enough, or it's secreting it and the body is not able to use it. So in type 1 diabetes, the symptoms would come on really quickly, and it can take maybe a few days to a week for symptoms to show. But with type 2 diabetes, sometimes the symptoms will not show at all till you start developing complications. And this can be very severe because some of the complications are irreversible, and it can be very devastating, both mentally and physically. So today I'm just going to go through some of the alarming symptoms that we all need to take note of. So when we start experiencing them, we know when to go to the doctor or when to seek medical help. So the first symptom of diabetes that you need to take note of is being tired, and this would occur as a result of excess insulin in the blood. As a result of excess glucose in the blood. The body is meant to convert glucose to energy, but when this is not happening because of inadequate insulin, you don't get enough energy, and when this occurs, you become very tired very easily. And because you're tired, you're not able to function during the day. Another symptom that is very common and very early on you would experience is being thirsty and peeing a lot. Peeing a lot goes with becoming a lot more thirstier, and peeing a lot would occur because your kidney is meant to convert, your kidney helps absorb some of the glucose into the blood. But when the glucose levels are higher, the kidney is not able to function in that sense. And this causes the kidney to excrete a lot more of the glucose. When this happens, it draws some water from your body to allow it to excrete the glucose. And this causes you to become a lot more thirstier. And when you are a lot more thirstier, then you drink a lot of water. Ideally, a normal person or an average adult would drink about 2 liters of water in a day. But when you have excess sugar in your blood or you're peeing a lot, then you're drinking about maybe 4 liters a day. And this happens a lot in the night. So when you experience thirst that is in excess, you would have to speak to your doctor. This is very essential. There's some people who would come to the pharmacy and say, I get thirsty a lot at night. This is a warning sign that there might be an underlying condition. Sometimes it might not be diabetes, it might be something else, but it's worth speaking to someone who is trained and specialized so further checks can be carried out. Earlier on, I talked about peeing a lot. Normally, we would pee probably maybe up to maybe 6 times or 7 times in a day. But when you have excess sugar in your blood, you would be peeing a lot more than usual. And as you are peeing a lot and taking in more fluids or more water from your body, your skin tends to become drier than normal. So anytime you experience a dry skin condition, it's worth checking with a healthcare professional. So excess glucose in your blood first will make you pee a lot. It will make you become thirstier. It will make you experience dry skin, and dry mouth is another symptom. And this is all because you are dehydrated as a result of you peeing a lot. Another symptom also is you tend to become hungrier more often. And this is also due to the fact that your glucose levels are higher and it's not being converted to energy as a result of lack of insulin. So this is also something you need to watch. One other alarming symptom of diabetes is you losing weight with no explanation. That is loss of weight that is not intentional. That is, you are not dieting or you are not doing any excessive exercise, but then you are losing weight. And this is weight loss that is persistent or continual. And anytime you experience weight loss with no explanation, then you need to visit your doctor and have a chat with them. One other symptom that is more common with type 2 diabetes is vaginal thrush, or this fungal infection caused by yeast. This is very common in both women and men who are experiencing early symptoms of diabetes. And this would occur because the fungus, that is the yeast, thrives in very sugary conditions. So as you're peeing as a result of excess glucose in your kidneys, there is more sugar for the fungus to thrive. And this can result in vaginal thrush, oral thrush, and thrush around the genital area in men. Anytime you realize that you are experiencing this symptom, it will be worth checking in with your doctor, because this could be an alarming or warning sign that you have diabetes. One other symptom that you need to take note of is your eyes can become blurred, and this has got to be checked. When your eyes are becoming blurred, it can be a result of so many different things, but one reason could be that you are suffering from diabetes. There are other symptoms also, like numbness of your fingers and your toes. These would have to be checked by your doctor. One other symptom that you need to take note of as well is that you would develop slow healing sores when you get maybe a cut or a prick on your skin. This would take a longer time to heal than normal, and this is as a result of diabetes or excess glucose or your nerves getting damaged or not functioning properly as they are meant to be functioning because of excess glucose in your blood. I hope this video or this short content is beneficial. Please take note, anytime you have these symptoms, it's worth checking in with a healthcare professional so you can be checked thoroughly. Normally, when you visit a doctor with any of these symptoms, bloods will be taken and sent to the lab. When you go to the pharmacy, we would do a normal fasting blood sugar test there and then, and we'll be able to tell you whether your blood sugar levels are higher or not. With the doctors, they will take your blood and send to the lab, and this is a more accurate test. They will test for HbA1c in your blood, and there are targets that when your HbA1c reading is higher than, then it means you might be pre-diabetic, you might be type 2 diabetic, or you might be type 1 diabetic. So there are things that can be done for you. They would also advise you on what foods to eat, exercise to carry out, especially if you're pre-diabetic. Your symptoms can go away when you are particular about your diet, you eat healthy, you exercise, you avoid alcohol and smoking, and you lead a healthy life. This can be reversed. But if it's far advanced, then there would be medication prescribed for you, as well as lifestyle changes that you would have to carry out. So please do take note of these symptoms. Anytime you experience them, phone your doctor, make an appointment for an early diagnosis and treatment. I just want to say thank you all for joining me. I'm really grateful for the support. I can see you, Sweet Na Kitchen. I can see Umoto Lifestyle, Bibliche Lifestyle. I saw you earlier on. Thank you all for the support. I really appreciate you. And I will be coming on live once every 2 weeks. It's going to be a Monday afternoon because every other Monday I'm off work and I can come on and have a chat with you. So do pop in questions, topics that you want us to talk about, and I would prepare and we would share our knowledge and our experiences. Thank you once again for your time, and hopefully I'll see you soon. Bye for now.